Today, we are talking about getting an early autism diagnosis and parent-led advocacy with a very special guest who's a BCBA and mom named Rachel Freedman. Today, we talk about what were the early signs in her son Max, also what she knows as a behavior analyst that other professionals should know to help families with kids with autism and toddlers showing signs. It's a great episode. Hope you love it like I do. Let's get to it with Rachel Freedman. Okay, so happy to have Rachel Freedman on this podcast. So welcome, Rachel. Thank you for coming.
Thank you. It's great to be here, Mary.
Yeah, so we've been going back and forth a little bit over social media and email, and I know that you were a behavior analyst before your son started showing signs of autism.
Mhm.
So, just tell me and our listeners a little bit about your fall into the ABA world, and then we'll
Sure.
talk about your personal journey with autism as well.
Yeah, I would love to. So, when I was in college, I started to take some psychology courses and I ended up adding on a psychology minor that I hadn't originally planned on. And I was taking a lot of courses in child development, which I really found fascinating. So, I decided to just get some experiences like internships and summer jobs working in preschools. So, my mom, who is an early intervention program director now, at the time when I was in college, she was a special needs coordinator at a preschool near where my family lived in Massachusetts. So, as a summer job when I was in college, I just started working as a teacher's assistant in the preschool program. And it was, a typical preschool program. It wasn't specifically designed for children on the autism spectrum, but there happened to be some children in that preschool program who were on the spectrum. And so one of the things that I ended up doing as an assistant to the classroom teacher was supporting the kiddos who were on the spectrum, helping them with some visual supports and working on expanding their language and play skills. And I really loved that. So then I said, okay, so what can I do now while I'm still in college to get some more formal training in working with children on the autism spectrum? I was reading a lot of books about autism and I learned about ABA, and it seemed like it was really the most evidence-based approach to helping children with autism to maximize their potential and learn language and other important skills. So I applied for a part-time job my senior year of college with the Wisconsin Early Autism Project. So that actually was one of the NIMH replication sites of Dr. Lovas's Young Autism Project, which looked at really intensive ABA programming for very young children diagnosed with autism. And so I had a really wonderful experience just working a few hours per week, providing home-based ABA services to a couple of children with autism in Wisconsin near my college. And when I graduated from college, I knew I wanted to pursue a career in ABA. So I ended up applying to graduate school and I earned my master's in behavior analysis from Simmons University in Boston.
Okay. And you're living in Boston now.
In the greater Boston area, if you kind of stretch it out a little bit. So I live about an hour west of Boston, just outside of Worcester, Massachusetts.
Okay. So your son, Max, do you just have one child?
Yes, we only have Max. Yeah, his name is Maxwell, but everybody calls him Max for
Okay.
short.
So your son, Max, was diagnosed at 13 months of age, which
Yes.
is super early. So
Mhm.
what early signs did you notice that
Oh,
helped, you trust your gut to pursue any kind of evaluation?
yeah, so a couple of things. So first of all, I did have a very high risk pregnancy with Max. So just knowing what the research literature shows, having a high risk pregnancy and having a baby who's born with some health challenges tends to be correlated with them having an increased likelihood of autism or other developmental disabilities. So I was a little bit just more proactive than I might have been if I'd had a less high risk pregnancy and if he hadn't had some medical complications right before and after his birth. So that was part of the reason that I was so vigilant about it. But also, I had learned through my professional work as a BCBA about something called the Milestones Tracker app, which is from the CDC, the Centers for Disease Control and Prevention. And it's this really great app that looks starting when babies are 2 months old and going all the way up until they're 5 years old about what typical developmental milestones are in different areas of child development. So it looks at language, cognition, social interactions, play skills, gross motor skills, things like that. And so I was tracking that just from literally when Max was born, just because I always thought, especially growing up with my mom working in early intervention and, knowing how much progress I've seen children make when they started ABA services at a young age. I just thought if Max was delayed in any of his developmental milestones, I wanted to know right away and follow up and get him some supports. So I was tracking right away, and Max was born 3 weeks early, so I kind of figured I had to build in a little extra time. So I really didn't start to evaluate him against the 2 month milestones until he was 3 months old. But when he was 3 months old, the big thing I noticed was that he didn't track objects at all visually. He didn't follow objects with his eye gaze, and he actually didn't visually recognize me or my husband or any of his caregivers. He only responded to our voices, and he would be very excited when he heard us talking or singing to him, but when we would walk in the room or come over to pick him up, he actually didn't show any awareness at all that we were there, which I knew was not typical of how babies at that age would interact with their caregivers.
Were you worried that maybe he had a visual impairment at that
I
point?
was, yes.
Yeah.
And one of the things that's really tricky, I think, with infants in particular is, with older kids, we've gotten really good at sort of differentiating between autism and other types of developmental delays or developmental disabilities, not so much with babies. In fact, the trajectory for babies is sort of either they're meeting their developmental milestones or they're not. And at this point, especially with newborns or infants, it's very hard to tell, is it a vision issue? Is it autism, or they're on the trajectory where they're later going to be diagnosed with autism? Is it, a genetic syndrome or some other global delay? We were really unsure why he wasn't responding visually to either people or objects. So yes, I did originally think that it was potentially vision related. And so in addition to that, he was born with congenital torticollis. So his neck was sort of twisted and not in the typical position. And so as a result of that diagnosis, the torticollis, he was found eligible for physical therapy through our state's early intervention program. So we ended up having him evaluated by the early intervention program. In a lot of states, it's called birth to 3. In Massachusetts, we call it early intervention. And so my husband actually had to drive Max in a snowstorm to their office a few towns over from where we live, and was able to get him there. And I was at home following along on Zoom. And then my husband was there because at this time during the COVID pandemic, they wouldn't allow multiple parents to be there at the same time. So only one parent could physically be there. And because it was a snowstorm and I wasn't comfortable driving in it, my husband, Dean, was the one who was physically present in the early intervention evaluation room with Max. And I was there following along on Zoom. And so they used the Battelle developmental inventory. And so when they completed that, they found out that in addition to Max automatically qualifying for the physical therapy because of his diagnosis of congenital torticollis, he actually was showing delays across the board. So even for, at that time, he was 3 months old, for 3-month-old infants, they are, evaluating their motor and social and communication skills and personal skills like self-feeding or even just being able to appropriately eat, from either breastfeeding or a bottle. And so he was delayed across the board. So he actually would have qualified for services in every area, even aside from the torticollis.
And so you were able to get those therapies.
Yeah, so we were able to start right away. So when Max was 4 months old, that's when he started receiving the early intervention services. And initially, it was physical therapy. That was only twice a month. I wanted it to be twice a week. And of course, they said twice a month. And I said, well, then show me the data. I want to see that he's making really significant progress with getting physical therapy for 1 hour every 2 weeks. And sure enough, he wasn't when they collected the data. So they did increase it to 1 hour per week. And then in terms of other services, there was just a monthly consultation with a developmental specialist. So that was more like general about feeding strategies, sleep strategies, not really direct service to
Yeah,
Max.
yeah,
And then he did also qualify for consult from a program for children with visual impairments. So the interesting thing was because of his atypical visual responses, he met the criteria for early intervention in Massachusetts to have services from a teacher of the visually impaired. But that was just, again, more of a monthly consult to us about different resources and strategies we could use. And to be honest, none of the things that were specific to visual impairments really seemed to make a difference for Max. And I think that probably speaks to the fact that his atypical visual behavior wasn't from a visual impairment. He could physically see. It was that social piece that you see with autism where he didn't know that someone's face or the actual person was a salient stimulus to look
yeah,
at or orient
yeah.
to.
And Dr. Omni Klin has done a lot of
Hmm.
work with visual tracking. And in my book, Turn Autism Around, which you can get the first two chapters for free at
Hmm.
turnautismaround.com. We can link it in the show notes. I talk about his work, and then he published a study right as I was finishing writing my book. And I incorporated that study, and then I did a solo show on his work,
Hmm.
because he is finding a very unusual pattern for visual tracking
Yeah.
and missing that social piece. So we'll link all that in the show notes. I also have um, an interview with another mom who had a preemie, a micro
Hmm.
preemie, so a
Okay.
very premature baby, and some of the confusion that comes with that. It sounds like it was so early on, and had
Hmm.
not had the torticollis,
Yes.
probably would have gotten some resistance from the regular pediatrician to just kind of wait and see. So many
Yeah. So
parents out there are told to wait and see, but
Well, so
what
that's actually
you say?
interesting
Yeah.
because, our pediatrician, I do my research on everything. Some people would say maybe a little bit to the extreme. But so, I found a pediatrician while I was still pregnant with Max that I thought would be really great. And I mean, and he has been really great to work with, and he's affiliated with our local academic medical center at the University of Massachusetts outside of where we live. It's, nearby and everything. And so he's been a faculty member at the university for many years. So I thought, okay, this is great. We have a really knowledgeable pediatrician. But the one who noticed Max's atypical visual behavior was me, not the pediatrician. And when I sent the pediatrician a note in my chart, which is our electronic records management system, I sent the note and said, this is what I'm noticing with Max. Don't you think this is pretty atypical for a 3-month-old baby? And should we refer him to early intervention? And the pediatrician wrote back and said, you're a better observer than most people. And yes, it is an appropriate referral to early intervention, but you should be the one to call early intervention and put in the referral.
Huh.
So,
Yeah, well, at least he didn't do the wait and see, because
no, that was good. He
blown
did
off
say
everything.
that that is a concern and you should make a referral to early intervention. But I was actually surprised that as a parent, I was the one who had to call early intervention and describe the concerns and the reason for
A
the
lot of
referral.
people don't realize, but in birth to three or 3 to 5 or school age,
Mhm.
um, you can make a referral yourself. And a
Yes.
lot of times that's better, because if the physician's office calls them, they're not going to have everything, in place. Plus, they need to make
Mhm.
an appointment probably to come to your house,
Correct.
or for you to take them to a center. And then
Right.
it's just like a middleman that doesn't know what your schedule is. So when in doubt, we will link also the CDC milestone tracker. We've done
Mhm.
other calls, other interviews on the CDC milestones, which did change a couple of years ago. Um, but I never knew. I mean, my son was diagnosed in 1999, so a very, very long time ago,
Mhm.
when before the internet was even really a thing in households, and before all these trackers and everything. And I didn't realize as a nurse that I was the one that really needed to keep an eye on
Mhm.
all these milestones. and not necessarily just rely on the physician's office at the 4 month
Right.
visit or 12-month visit or whatever to
Hmm.
catch things. The other problem which I see, which I write about in one of my books, I'm sure, is at least back in the 90s and
Hmm.
2000s, between the ages of 2 and 3, there weren't visits scheduled. And so
Mm,
that's a really big time when you could be noticing things. And so people don't think
definitely.
like call and make a sick appointment to discuss development
Right.
or send a my chart note to the pediatrician
Hmm.
and discuss your concerns. So you can't afford to wait until the next well visit
No.
to discuss something this important. So I think that you
Right.
make a couple good points there that I wanted to highlight. So, so you took action, you contacted early intervention, you contacted your doctor.
Hmm.
Um, what are 2 to 3 things you did early on as a parent that made a big difference besides getting the support?
Hmm.
Anything else that made a big difference?
I think just spending as much time as possible interacting directly with Max because I noticed all of the great things about Max, but also the things that he was struggling with. And I felt like I could describe everything in great detail to the pediatrician or to people that were evaluating him because I really knew him inside and out. So I think that was the big piece of it. And also just enjoying him. Like, even though I did have developmental concerns really from the time he was born, I also experienced so much joy just spending time with Max and getting to know Max. And I think just, enjoying your child while they're young, that's really important to do, but it's not wait and see and just enjoy them. You can enjoy spending time with them and also be very proactive in getting them supports at the same time.
Yeah, that's great. So, how can we parents become strong advocates without burning out?
That's a great question. So I think you have to think about what is really going to make a big difference for your child, like starting ABA services earlier, starting speech and language or occupational or physical therapy services that they need, right? Those are battles that you might have to fight to get the services started or make sure they're getting services at the frequency and intensity they need and with really qualified, highly skilled providers. But there are other things that you're not going to choose that battle. So I mean, I think sometimes there may be certain strategies that service providers suggest, and as long as you have other strategies that are effective, you don't necessarily have to, go into every strategy with every service provider and talk about whether or not you agree that it's effective for your child. Or I think there are times where, you know, you might feel like, well, ultimately it would be better if we used different materials or different toys for working on these skills, but to feel that you have to run out and buy every possible toy or item that would be helpful for your child right away, that's also not sustainable. So I think just talking with the service providers and with other people that are taking care of your child and figuring out what are the high priority items. So Max had a really hard time with eating and sleeping from the time he was born, so anything that we could buy that would help him with his bottle feedings or help him to, be more successful in getting enough formula or enough calories, that was worth going out and buying or ordering from Amazon, getting it however quickly we could get it. But there were other things where people would suggest like 20 different types of baby toys, and we didn't have to buy every single toy right away. Maybe introduce 1 or 2 new toys and see how he does, especially because at that time he actually wasn't interested in the toys and we were just working on him orienting to the toys.
Yeah. Yeah, and you made a good point earlier when you said you just spent a lot of time with Max, getting to know him and what he liked, what he didn't like, what he was interested in, what he was turning towards.
Mhm.
And I think especially during COVID and immediately post-COVID, um, I think when parents have their jobs that
Right.
were also at home, and it really messed with everybody's orientation about like how things should be. But all kids before and after COVID, all kids, whether they have developmental delays or not, really
Mhm.
need to be engaged
Yeah.
during most of their waking hours,
Right.
which when people say, oh, well, they only have X amount of hours of therapy a week, or, they have 40 hours, so they're good. There's still about 100 hours a week of wake time. And that seems very overwhelming, but
Yes.
kids can't be online orienting to repetitive things. And that's a big thing in the OmniClin,
Hmm.
which I illustrate in that podcast, is the repetition of videos, which kids with autism tend to love,
Right.
are really bad for them.
Yeah, and when they're under 2 years old, right, the American Academy of Pediatrics recommends no screen time. So we were pretty strict about that. I would say at least up until he got pretty close to turning 2, where we really weren't using videos. We would play music for him, and he loved songs. He's always loved music ever since he was born, and he would orient towards music, turn his head or his body towards where the music was coming from. When he got older, he started to dance and, keep the beat with music. Now he'll sing along to lots of different songs, and he makes up his own songs. He's very musically inclined, but we really didn't show him videos when he was an infant and a toddler. So just because of the COVID-19 situation, when Max was born, we actually couldn't take him very many places. So we mostly had to entertain him at home, and we weren't showing him videos. So when you think about that, that's a ton of hours that you have to figure out a way to engage with your baby.
Especially when they're not really interested in toys and not really
Correct, right. And
expressing.
other people with kids that young, or even my friends who had kids who were older at that time, would say, well, what about this rattle toy? And you can play catch and you can play with all these toys. And I had to remind them that I actually couldn't get Max to orient towards the toys, even if the toys made noises. He had no interest in the toys, and I couldn't get him to play with the toy or even orient towards the toy when I was playing with it at that point. So it was really hard to come up with ways to engage with Max.
Yeah, yeah. And I did do an episode about the techniques that Miss Rachel uses,
Oh, yes.
and speech pathologists use, and
Mhm.
I use. I have Miss Mary videos that I made well before Miss Rachel was even
There
in
you go.
college. And there are some real benefits to, not zoning out in front of Miss Rachel, but making it an interactive kind of thing.
Mhm.
Um, so there are some shows, especially now that he's 3, almost 4, right?
Yes.
Yeah. So what do you tell parents if they are told, they're too young for ABA, or they won't benefit from services yet?
So I just tell them that really the research shows us, and also my personal experience as the mom shows that the younger kids are when they start ABA services, the more they benefit and the more likely they are to make effective progress and learn skills more quickly. And also, every day that your child has is valuable, right? So if as a parent, your child isn't where they should be developmentally, or you have concerns, then you don't want to waste any days. You want them to be getting the support they need as soon as possible.
Yeah. So as both a behavior analyst and a
Mhm.
parent, what do you wish professionals knew about working with families?
So I think it's really important for professionals to just have empathy and understand that it honestly can be a 24/7 job being the parent of, I mean, really any newborn baby. But that phase that I think all parents go through when they have a newborn baby, it lasts a lot longer for families that have a child with developmental delays or disabilities, because it takes a long time before you can go and do things like be able to use the bathroom independently, or go and cook dinner or do something, and not feel that you're leaving your child to their own devices and they don't know how to entertain themselves, right? So it takes a long time to get to the point where you feel that you can walk away from your child can appropriately engage in an activity even for a few minutes. It takes a long time to get to that point, I think, for us as families of children with different needs. And also, just sometimes it's exhausting, right? Because we have to be the ones to make all these referrals for services, whether it's early intervention birth to 3, or for preschool or school age special education services, or if we're pursuing additional ABA services or other outpatient services through health insurance, right? It's a lot that we have to advocate and navigate, and a lot of paperwork and phone calls and scheduling. And that's on top of, the fact that our kids often need more help with meal times and feeding themselves and getting themselves dressed and ready for bed and learning toileting and all the activities of daily living. So it's just a lot to juggle. And I think it'd be really helpful if professionals could have that lens and understand how much these parents are juggling.
Yeah. Yeah, and that's not just for the little guys either.
Right, exactly.
Like when I used to do consultations in schools and you'd have second graders or whatever and they'd have very significant needs
Hmm.
and I would just be like, "Oh my gosh, like what do the families do with these kids all
Yeah,
day long,
right.
all weekend long? Like
Hmm.
what does their weekends look like?"
Exactly.
You mentioned Max had sleep problems too. So
Oh, yeah.
if then you're sleep deprived, your
Hmm.
child's sleep is all messed up, everybody's exhausted, then they
Yes,
try to take a nap too late, and then you're like exhausted. It can become a very vicious cycle and it can go on
absolutely.
for years.
Oh, definitely.
And so
Yeah.
I do think that professionals don't always understand the complexity and
Hmm.
and within each family is a different dynamic, different levels of complexity, different. I mean, you just have Max,
Right. And that's the thing
and
because,
you're married too.
yes,
So you have a
so,
two-parent
right,
household. You have the education that one could only dream about as a new parent
right.
with a child with delays, and then you have one child, and you
Hmm.
have probably the financial resources and support that you could, so it's just, yeah, I think in general, just professionals just need to be aware that even if
Hmm.
all situations are ideal,
Hmm.
um, it's still really hard.
Really hard. Yeah. And again, we're so fortunate that we have the two-parent household. We have a lot of extended family that lives nearby that also helps out. So once in a while, my husband and I can go and get coffee and not have Max with us and just talk to each other, right? A lot of families can't do that because they don't have anyone who can watch their child. And it's really hard if you can't just have a little break or a time to just, have some adult time. So I think, especially thinking about individuals with really intensive support needs as they get older, it's so important for parents to be able to get a little bit of respite and have some breaks and some time for self-care. So it'd be really great if professionals would be aware of that need and think about how they can help with that as well.
Yeah, I wanted to just mention this article as a qualitative study I wrote in 2007. It was published in a peer-reviewed journal. It's called The Experiences of Autism Mothers Who Become Behavior Analysts, a qualitative study. And the reason I wanted to bring it up now, and these 6 women were all um, moms of children with autism first and then became behavior analysts. You're the opposite. You were already well trained and then were able to help with getting Max diagnosed. But there
Mhm.
is a question in here, as a parent and BCBA, what would you like professionals to know? And also, what kind of parent training do you think is best? So like
Mhm.
if you had to wave your magic wand, if you had an hour with
Mhm.
with a mom or a family or a group of families of newly diagnosed kids, what would you teach them in an hour that you think would make a big difference?
So I think the few things I would focus on first would be just really pairing, establishing that positive rapport so that, it's enjoyable for both the mom and the child to spend time together. I think just maximizing opportunities for communication. And if it's a baby or a child, who's working on very early communication skills, it might just be something like they make eye contact when they want their mom to continue tickling them. Or if it's an older child or a child with some more language skills, it might be requesting for specific items or activities that they want. But I think just maximizing opportunities for the child to communicate with a parent is really important. And then I think the third thing is just focusing on those activities of daily living, because whether it's, an infant learning to feed or a much older learner who's still working on, eating a variety of foods independently, or whatever the situation might be, those activities of daily living are things we all have to do as individuals and as families every day. And if you can make that a little bit easier and something that, parents and children enjoy participating in just a little bit more, that will really go a long way.
Yeah. Yeah, I agree with all of that. And I also will add that and actually in the study, um, problem behavior,
Hmm.
how to prevent problem behavior
Yes.
across the board, by not being overly reactive, by setting up systems. That seemed to be a big thread because
Yep.
studies have shown that children with, aggression and self-injurious behavior, their their parents, especially their mother's stress level is really through the roof.
Definitely.
And that's one thing across the board in during self-care, during
Hmm.
um, language activities, during playtime, during leisure time. If you can keep problem behaviors at bay, everybody will be a lot less stressed.
Hmm. And I think also just making sure parents know that it's not their fault that their child engages in problem behavior, and that problem behavior can decrease over time with good strategies and interventions in place, and that those problem behaviors can be replaced with functionally equivalent replacement behaviors that are more appropriate. So there's hope if you're feeling really stressed because of your child's problem behaviors, that it can improve. And, it doesn't mean that just because your child had a tantrum today or your child engaged in physical aggression today that, this is the way it's always going to be.
Yeah. So what if parents feel like ABA, whether they've tried it or not, is too
Mhm.
rigid, is too intensive, or isn't working or isn't going to work? What would you say?
So I would say that although I can certainly understand the concerns, and I have seen some practitioners implement very rigid programming, ABA is a really broad science that can be applied in lots of different ways, including ways that are really fun for the child and flexible. And that there's a lot of research showing that different ABA methods are effective in teaching lots of different skills and decreasing a lot of challenging behaviors, especially for individuals with an autism diagnosis, although it's not limited to only learners with autism, but it's really shown through the research literature to be very effective. And I think I would talk to them about specifically what are some things you would like to see in programs for teaching skills to your child, and what are some things that you would like the service providers to avoid, or things that you really would not want us to use as a strategy with your child.
Yeah. I agree. I also wanted to bring up another study about in a solo podcast I did. The study was called, and it was 2023 study, so it's really pretty recent. It's called
Mhm.
Persistence of Autism Spectrum Disorder from Early Childhood Through School Age by Elizabeth Harstead, MD, MPH, out of Boston Children's Hospital. And from my memory, like I said, we can link it in the show notes, but I did a podcast episode about this study and I sent it to Dr. Harstad, who's the initial primary author, and
Mhm.
she said it was spot on. But they took 213 kids, I think, that were diagnosed with autism between the ages of 1 and 3,
Mhm.
and then re-looked at those kids between the ages of 5 and 7, and 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 it wasn't like other studies where it looked at the amount of ABA kids got,
Mhm.
whether they got ABA or not. They just looked at them. These are the kids. They're diagnosed with autism, and then we're looking at them again.
Mhm.
But it was out of Boston. It was a higher socioeconomic set of families, and most of the kids did get some form of ABA.
Right.
But the only two variables that made a difference in the forgetting the actual percentage, but it was like 37%, I think, no
Mhm.
longer qualified for the diagnosis. It was pretty high. The only two variables that were at play was females did better. Female little girls who were diagnosed did not meet criteria when they were relooked at. And then good adaptive skills on intake. Those were the two factors that really played out for the best outcomes. And yeah, so we can link that show
Mhm.
in the but Max is now 3 turning 4.
Right.
Tell me and our listeners how he's doing now.
Yeah, so he has made amazing progress, especially in the area of language. So, I mean, he will tell stories, he tells jokes, he talks about things that happen during the day, sometimes more accurately than others, but you kind of expect that with preschoolers. But I mean, he really can have conversations depending on his level of interest in the topic. He sometimes answers questions, other times he'll respond to a question with an, off-topic comment or something that he wants to talk about. But I mean, he has made tremendous progress with his receptive and expressive language skills, his vocabulary. For those that are more familiar with verbal behavior, he has lots of demands. He'll request exactly what he wants, the way he wants it, when he wants it. He'll negotiate if it's not exactly what he wants. He has great labeling and commenting skills and all those types of things. And he can answer and ask a variety of questions. So his language skills have really blossomed. And he went from being really profoundly delayed. So when he was a year old, he really didn't use any words functionally, not even single words. And we were just trying to get him to sign more or all done, and he would mix up those two signs. So it's amazing that he's gained so much language over the past few years. In other areas, he still needs more support. Adaptive behavior is really a challenging area for Max. So he's not toilet trained yet. He's showing signs of readiness. We tried introducing a more formal toileting program with him, and he reacted by engaging in a lot of challenging behaviors and verbally protesting and telling us that he was not ready to sit on the toilet. So we took a step back from that, and we're getting ready to reintroduce the toileting program this summer. But he does still need a lot of help with things like, you know, any type of activity of daily living, whether it's getting dressed, changing his clothes. He loves to take a bath, but then every time it's time to wash his hair, he'll protest, right? So activities of daily living, adaptive behavior, he still has a long way to go and needs a lot of support. And then he is in preschool now, and through his individualized education program or IEP, he goes to an integrated preschool classroom in our public school district. So it's made up of half students with disabilities, half students without disabilities. And within that classroom, they have up to 15 students in the classroom. So initially, the school district wanted to try Max being in that classroom without having a specific staff member assigned to support him. And they found that that was not very successful because Max still needs a lot of reminders to attend to what the teacher is talking about or what the teacher is asking the class to do, especially in a larger group setting. So they ended up assigning him a shared ABA technician who supports Max and one other child in that classroom. And Max has been pretty successful with participating in the preschool routines and activities with the shared ABA technician. And then he still continues to receive speech and language and occupational and physical therapy services at school as part of his IEP as well. And we have ABA services at home through our health insurance after school a few days every week. So he's made a ton of progress, but he definitely still continues to require a pretty substantial level of support.
And Rachel has my first book, but we're going to make sure she has my second book because like a lot of the things you're talking about, like even hair washing,
Mm-hmm.
that is covered, how to desensitize that. In the Dr. Dennis haircut chapter, and we have a sleeping chapter, we have a potty
Mm-hmm.
training chapter. I'm also going to share the toddler preschooler course with Rachel. So
Right.
she has a ton of experience, but I do think that all the struggles you're continuing to have,
Mm-hmm.
we could probably some of the techniques in my courses might also be helpful. So
Yeah, absolutely.
that's great. So before we wrap up, I like to ask this final question. Part of my podcast goals is not just to help the kids, but also help the parents feel less stressed. So do you
Mhm.
have any like self-care tips or stress reduction techniques that you use?
Yeah, definitely. So, right before Max was born and when he was a newborn, I actually did see a therapist just for some counseling to talk about some of the things that were really stressful with the high risk pregnancy and with caring for a newborn who really didn't sleep at night, right? So some of those things, I think it's important for families to know that it can be super stressful, regardless of whether or not your child is presenting with developmental delays, just being a new parent or adjusting to changes. So it's great if you can talk to someone. It could be a therapist, or maybe you just have a trusted friend or family member that you can vent to and talk to them about what is stressing you out. Sometimes just labeling it or acknowledging that that is a stressor in your life, I think really helps a lot. And also, I find that just going outside and taking a walk and just focusing more on the scenery and what's going on outside, that really helps me a lot. And then I love to just read about things that don't have anything to do with autism or ABA, but just, like read a good novel or a mystery or a magazine that features great beach houses on Cape Cod, right? Just something that's unrelated. And I think if you can get your mind engaged in that, whether it's a favorite book or magazine or a show or movie that you enjoy watching, that's important. And then the last thing is just having a village, right? So initially, I always thought of it as we're building Max's village, and that's true. And when you find caregivers or extended family members or friends that can help support your child, that's amazing. But also, I need my own village. My husband needs his village, right? All of us also need villages. We need to have people who will ask us if we need anything, or who will stop by for coffee or tea, or maybe they'll offer to make a meal or watch Max for an hour or two so we can get something done. So I think just make sure that you have your own village too as a parent, because this is a marathon.
Yes, it definitely is. I love all those points. I say it's a marathon on a roller coaster.
Yep.
And it's got lots of twists and turns. So, we will link your contact in the show notes. Rachel Freedman. You can find her on LinkedIn. We'll link that. So you've been really valuable information here. It sounds like Max is doing great, and
Mhm.
will continue to do great, and we'll see, um, I mean, I think you had your eyes wide open. There wasn't, any time for denial. There was just time for action. But I also
Mhm.
like the fact that, you know, you remained, joyful
Mhm.
and positive throughout the whole thing. And I think it's a good lesson for all of us.
Absolutely. And I think if I could just add one more thing, Max brings so much joy, not just to me and my husband, but to so many people. And I think it's important to recognize that, yes, his challenges, especially the challenges he has with adaptive behavior and transitions, are part of his autism, but also the fact that he's so funny and creative and has this amazing sense of humor, and he's very quirky and affectionate. Those things can also be related to his autism, right? So there's both struggles and joy within him being somebody who's on the autism spectrum.
Yeah. Well, I think that's awesome. All right. Thank you so much. And we'll be anxiously awaiting an update on Max in some time from now. So keep in touch.
Will do. Thank you so much, Mary.